Cognitivism in healthcare ethics. When healthcare professionals make ethical statements, they usually speak as if those statements mean something more than personal feeling or emotional reaction. When a clinician says that it is wrong to harm a patient or that respecting autonomy is ethically required, they are typically making a claim they believe can be evaluated as correct or incorrect. Cognitivism is the metaethical position that explains this way of speaking. Cognitivism holds that moral judgments and ethical statements express beliefs that can be true or false. According to this view, ethical claims are cognitive propositions. They convey information about moral values and moral reality rather than merely expressing emotions, attitudes, or social preferences. In healthcare ethics, cognitivism supports the idea that ethical reasoning is a rational activity. When clinicians deliberate about ethical dilemmas, they are not simply venting feelings or negotiating preferences. They are making reasoned judgments that aim to accurately reflect moral facts, moral obligations, or moral standards. This perspective stands in contrast to non-cognitivist views, which treat moral language as expressive rather than truth-apt. Cognitivism insists that when healthcare professionals debate whether an action is ethical, they are engaged in a meaningful disagreement about what is actually the case morally. In practical terms, cognitivism explains why ethical education in healthcare emphasizes argument, justification, and evidence. Ethics committees do not ask participants how they feel about a case. They ask for reasons. Policies are defended with moral arguments, not emotional reactions. Codes of ethics are written as statements of obligation, not expressions of sentiment. Cognitivism also underlies the structure of ethical disagreement in healthcare. Two clinicians may disagree about whether withdrawing life-sustaining treatment is ethically permissible. Under cognitivism, this disagreement is not merely a clash of preferences. It is a disagreement about which ethical judgment is correct, given the relevant moral considerations. This makes ethical dialogue possible. If moral statements can be true or false, then ethical reasoning can progress through clarification, reflection, and critique. Participants can be mistaken, revise their views, or offer stronger justifications. Ethical reasoning becomes a disciplined practice rather than a matter of taste. In your healthcare ethics framework, cognitivism functions at the meta-ethical level. It does not specify which ethical theory, consequentialism, deontology, virtue ethics, or principlism, is correct. Instead, it explains why ethical theories make truth claims at all. When healthcare professionals assert that patients have a right to informed consent, they are making a cognitivist claim. They are not merely stating a policy preference or cultural norm. They are asserting that this claim is morally justified and can be defended with reasons. Cognitivism also supports the role of professional accountability. If ethical judgments are truth-apt, then clinicians can be evaluated ethically in meaningful ways. Ethical review boards, malpractice cases, and professional discipline presuppose that ethical standards can be correctly or incorrectly applied. This perspective is especially important in healthcare, where decisions often involve irreversible consequences. If moral judgments were merely expressions of emotion, it would be difficult to justify holding professionals morally responsible for unethical conduct. Cognitivism provides the conceptual grounding for responsibility, evaluation, and ethical critique. At the same time, cognitivism does not require agreement about which moral facts exist or how they are known. Cognitivists may be moral realists who believe ethical truths are objective, or they may hold more modest views about moral knowledge. What unites them is the belief that ethical claims aim at truth. In healthcare practice, cognitivism explains why ethical uncertainty does not lead to ethical silence. Clinicians may struggle to determine the right course of action, but they do not conclude that ethics is meaningless. They continue to deliberate, consult, and justify their decisions because they believe better and worse ethical answers exist. Critics argue that moral truth is difficult to verify in the way empirical facts are. Cognitivism responds by noting that ethical reasoning relies on rational justification rather than experimental proof. Moral knowledge is not identical to scientific knowledge, but it is still a form of knowledge. In your healthcare ethics text, cognitivism helps clarify why ethical language matters. When healthcare professionals say that an action violates non maleficence or undermines justice, they are not speaking metaphorically. They are making claims intended to guide action because they believe those claims reflect moral reality. Understanding cognitivism is essential because it explains why ethical disagreement in healthcare is serious, why ethical reasoning is disciplined, and why moral education is possible. It affirms that ethical statements are not noise layered on top of clinical practice, but meaningful claims about how healthcare professionals ought to act. Cognitivism reminds us that healthcare ethics is not just about managing emotions or accommodating differences. It is about reasoning carefully, arguing responsibly, and aiming, however imperfectly, at moral truth.